I I
Yeah.
think it's like it's the worst thinking this world.
Yes, that's true.
When I go, when I went there to give them the papers, they
Mhm.
told us that it will be like 1 month, and we will have the formulario administrativo or the third, the last,
The
the last.
administrative part.
Exactly. So I present that uh, in July, the first week, I think. And
Okay.
then I went 1 week,
This meeting is being
one
recorded.
week before I get COVID.
Uh-huh.
And they told us that it will be for the August 10th.
Oh, so you have to
So,
wait a
yep,
lot.
exact, a lot.
Oh,
So I'm praying that the next Tuesday the paper it will be already. So Wednesday I want to go to my university to give all the things to have the title
yes.
with the
And
national
in
Provisión Nacional. Yep.
which university? In which
Nuestra Señora de
university?
la Paz. Nuestra
Okay.
Señora de la Paz. Yep.
Oh.
You
Well,
know,
you have to
my
be.
my university has a lot of opportunities for scholarships.
Okay. That's so
For
cool.
example, in my case, I had the scholarship of 50%. Yeah,
Wow.
all the career. Only because my father is a police officer.
Oh, that's so cool.
Yeah, yep. They have a lot of agreements with a lot of uh, careers, you can say, professions,
Yeah.
and a lot of agreement with a lot of professions.
Wow, that's so good. And thank God you choose that career and you have this opportunity. It's so cool.
Yeah, yeah. You can say
You're
yes.
not convinced now that you
Well,
finished the career, you're thinking about
sincerely, I
another
didn't choose. I didn't choose. When I was a little girl, I don't like medicine. I never thought to be a doctor, never in my life. But for things that happen in the life, I end in that career. But I
here.
finish and I think it's
Oh,
okay.
okay. Okay, Vale. You just have to be patient in this case
Yeah,
because it
don't worry.
will
Be
always
happy.
be like that. Yeah. Okay. Hi, everyone. I don't know if you can listen to me well. Yes, no.
Yes, teacher.
Okay, thank you. And can you see my screen?
Yes.
Okay, let's start. We have a lot of things to do today. Okay, Andres, can you read this part, please?
Sure. A full case history covers personal details, presenting a complaint, past medical history, PMH, drug history, family history, social and personal history, patient ideas, concerns and expectations, review of systems.
Okay, thank you. As you can see, we have those all of these subjects that we have to plasm into the history or medical history. I don't know if you have another path in your experience. For example, in my experience as a dentist, I have to add here the odontogram. I have to put the dental pieces one by one and with all the sides and maybe paint with some colors to refer what is the case of the patient, okay? In my case as a dentist. I don't know if you have another thing to add here on a medical
Well,
history.
well, in my experience, like a student, we read in class some case history
Okay,
in the class with doctors.
okay. So you have these parts, personal details, presenting complaint, past medical history, everything.
Yes, I have a question. What is patient ideas?
Patient ideas, concerns, and expectations. It's when the patient at the end of the questionnaire, the patient will ask you or will give you some ideas about their concerns, and you have to explain to them.
Okay, thank you.
And I don't know, any other one, or is the same in your country?
Maybe pathological antecedents. For example, if the patient have diabetes or hypertension.
Okay, yeah, but it can be involved in this past medical history, maybe. Okay, but it's good. Any
Okay.
one, or do you think it's complete?
Maybe it's okay. I don't know. I don't
Okay,
remember.
okay, Alex. Um, maybe you will tell me if I'm right or wrong. But I saw a medical history with part that it was mental history, maybe. I don't know if it's in every single history or maybe just in specialties.
We have the affiliation letter, the cause of the consulting, the history of the disease. Later, we have antecedents, pathological or not pathological. Maybe that's different here.
Okay. Okay, anyone else? Well, let's continue then with this part. Claudia, can you read this part, please?
Okay, teacher. Personal details. Normally, patients' personal details have been entered in their records by a nurse or administrative staff before a doctor sees. However, on later consultations, a doctor may wish to check details such as address, date of birth, occupation, or marital status. To find out or to check a patient's occupations, doctor asks, "Do you work? What do you do for a living?" patients may respond, no, I'm employed, I'm out of work, no, I'm retired, I'm a pensioner, yes, I work for a bank, I work in a factory.
Okay, thank you so much. Anything else that we can add on personal details in your experience? For example, on the Ministry of Health in Bolivia, we used idiom or language, in this case, native language, if it's possible. The grade of studies. What else? What else? I think is the only thing that is missing here. I don't know if it's relevant for you, but sometimes for us. Yeah. What else? Nothing to add. Can we continue?
I think yes, teacher.
Okay. Thank you. Let's go with this part. Ale Macias, can you read this part, please?
Sure. Um, to find out or to check a patient material status, doctor asks, do you have a partner? Patient may respond, no, I'm single, retired, divorced. Yes, I'm married. No, I'm widower, divorced. I live with my partner, of spouse, husband, wife. My spouse passed away last year. And note, a spouse can be a wife or husband. A widow is a woman whose husband is no longer living. A widower is a man whose wife is no longer living. To avoid saying someone is dead, a patient may say that person has passed away.
Okay, thank you. Once again, separated, okay? And the note, a spouse can be a wife or husband. It works for both. A widow is a woman whose husband is no longer living. A widower is a man whose wife is no longer living. To avoid saying someone is dead, patients may say that person has passed away. Okay, I think this part is clear. Carla Barta, can you read this part, please?
Talking about pain, case notes are kept for each consultation. The presenting complaint section of notes record the patient's symptoms. For example, temporal headache, severe throbbing, last 24, 48 hours. In this case, the patient complains of headache. For a list of the question, the doctor asked this patient, and for patient, this description of the other kinds of pain.
Okay, thank you so much. In this case, the patient complains of a headache. For a list of the questions, the doctor asked this patient and for patient's description of other kinds of pains. So what would you ask to this patient in order to find out what is happening to him? Nobody, guys? Really? Rina, are you here?
Yes, teacher. Hello.
Hi. Rina, what would you ask to your patient to find out what is going on with him?
If the patient told me that has a pain, yes, or headache. I'm sorry. Yes, that is the question, teacher.
Yes, yes.
Okay. Well, depends the age of the patient. For example, if the patient is an adult, I have to ask about the how is the what part in the head start the pain, for example. Like the picture, probably the patient told me that the pain having a tension pain or in around the eyes or in the middle of the head. After that, I have to ask him about the medication the patient takes. If the patient takes some medication for another disease, chronic or another disease, because probably the drugs causes adverse effect like a headache. Another one is about the lifestyle of the patient. For example, if how much water they take, how much water he takes, or about that moment, in what moment in the ordinary life or the ordinary routine the patient starts or feel the headache, because that depends. That is useful for a diagnosis.
Yes.
Mhm.
Okay, Rina, thank you so much.
Okay.
Thank you. So, as you can see on the picture, we have these types of pain. We have tension here, migraine, and I think it says cluster. I cannot read it, but cluster pain, it's like a pain that comes from a big area to a little one. It means that you feel more in a side than in the other, or what we call maybe in Spanish, dolor en racimo. I don't know if you have another way to say it. Do you have any questions?
No, teacher.
Okay. Okay, let's continue then. Jorge, can you read this part, please?
Okay, sure. Taking a history too. Drug history. Here is an extract from a medical textbook. It is essential to obtain full details of all the drugs and medications taken by the patient. Not infrequently, patients forget to mention or forget a name of drugs they take. Some may be over-the-counter remedies, unknown to the general practitioner. The significance of others, such as herbal remedies or laxatives, may not be appreciated by the patient. It is necessary to determine the precise identity of the drug, the dose used, the frequency of administration, and the patient's compliance or lack of it. It is important to ask about non-drug allergies or suspected drug reactions, and to record the information on the front of the notes to be obvious to any doctor seeing the patient. Failure to ask the question or to record the answer properly may be lethal.
Okay, thank you so much. Do you have any questions here? Maybe some word that you don't understand? Okay, what is the patient's compliance? Who can tell me? Mateo, maybe?
Yeah. Is the capacity of the patients to stick to the treatment. So it's like a complaint patient, maybe a patient who takes all the pills at the right times, and a patient with lack of compliance, with maybe a patient who doesn't take the pills or takes at the wrong times or wrong doses.
Okay. Okay, thank you. Do you understand now, or is there any doubt here? No doubts? Thank you, Mateo. Let's continue then. Melanie, can you read this part, please?
Yes, miss. To find out about drug history, doctors ask details of drugs and medications. Are you taking any medication at the moment? Do you use any over-counter remedies or herbal or homeopathic medicines? Which tablets do you take? Frequency of administration? How many times a day? Compliancy, do you always remember to take it? Side effects and allergies? Do you get any side effects or do you know if you are allergic to any drugs? In the answer, if the answer is yes, what symptom do you get after taking it?
Okay, thank you so much. Do you think we can add something else here? Any question that is important and it's missing here? Or do you have any doubts of vocabulary here? Can we continue then?
Yes, teacher.
Perfect. Thank you. Okay, I think you cannot read this part. I will. Family history. Do you have any brothers and sisters? Oh, sorry. No, the age, health, or cause of death of parents, siblings. The meaning of siblings are brothers and sisters, okay? Spouse, husband, or wife, and children. To find out about family history, doctors ask, do you have any brothers and sisters? You can say, of course, do you have any siblings? For both. Do you have any children? Are all your close relatives alive? Are your parents alive and well? Is anyone taking regular medication? How old was he when he died? Do you know the cause of death? What did he die of? Does anyone in your family have a serious illness? Okay, I think it's complete, but maybe in your experience, you want to add something else here? Any other question? Well, no questions here then. Can we continue?
Probably,
Yes.
teacher, the last question about is does anyone in your family have a serious illness? If the
Illness.
illness, if the patient say yes, the next question is very important because I have to ask about what kind of the illness the relative has, and how much time the patient, how much time the relative live with the illness and the medication, and yes, and that is another question.
Okay, Rina, thank you so much. Yes, we can add that question here. Thank you. Any other question that we can add here? I think now it's complete, right? Okay. Let's continue then. Mateo, can you read this part, please?
Yes. Social and personal history. Record the relevant information about occupation, housing, and personal habits, including reaction, physical exercise, alcohol, and tobacco, and in case of a children about school and family relationships. Typical questions in taking a social and personal history are: what kind of house do you live in? Do you live alone? Who shares your home? Who shares your home with you? How old are your children? Are any of them at nursery or school? What's your occupation? Do you have any problems at work? Do you have any financial problems? Do you have any hobbies or interests? What about exercise? Do you smoke? How many a day? Have you tried giving up? What about school? What about alcohol? Wine, beer, or spirits? Can you give up alcohol when you want? How much do you drink in a week? What's the most you would drink in a week? Are you aware of any difference in your alcohol consumption over the past 5 years?
Okay, thank you. Do you have questions here? When they ask wine, beer, or spirits, that means spiritual beverages, okay? Any other than wine and beer. Do you think there is another question that you can add here that it's important and that you usually use?
Teacher, I don't know if it's a normal question, but it's normal ask about insurance, uh, about the seguro.
Yes, yes, it's important because I think you will help your patient. If it's, in some cases, that question is needed because sometimes they don't have money to pay the attention. So if you know that they are with an insurance, of course, you can help them faster, right? And if not, you can maybe send with a social, I don't know what is the name of these people that help out on the hospitals, but they could help. It's a good question that we can add here. I think it's so much important. Okay, for example, here in Bolivia, I always ask to my patients if they have this SUS, for example, because most of my patients doesn't have money to pay their treatments, so I can help you that way. You can go there and maybe give some information, orientation, and then they can be assisted. Okay. Thank you, Andres. Any other question?
A question that I don't see here is regarding illicit drugs, for example, marijuana or cocaine, and that's really, really important.
Okay. Okay, thank you, Jorge. Yes, I don't ask that to my patients. I just ask if they have any other habits but maybe about the alcohol because they are older. I don't think they use it. But in your cases, I understand that you do. Okay. Any other question?
Yes, teacher. Actually, most of the young people smoke the vapes, I think.
What is
So
that?
that machines with
Oh,
flavors, I think, but it causes the same damage like cigarettes. But I
no.
think it's necessary to ask if they use that dispositives or devices
Hmm?
to. Also, when you ask if you do you smoke, you usually, to be specifically as Jorge says, with marijuana or cigarettes.
Uh-huh. I think they're in different, I don't know. It smells different every time. I have some friends that use that thing.
Yeah,
But yeah, I didn't know that it was the same as a cigarette.
yeah, it
It
causes a
causes the
lot of
same.
damage, not with the same mechanism, but it's it has some injuries in the lungs also.
Thank you so much for the tip.
Okay, good.
I will tell them. Of
Yeah,
course, do not smoke around me. You
yeah,
want to die, go over there. Okay, thank you so much.
okay.
Thank you, Claudia. Okay, I think those questions are important. Um, I don't know if we can continue here, or maybe there is something else to add. Can we continue that?
Yes, teacher.
Thank you. Valeria Guerra, can you read this part, please?
Sure. Taking history 3, reviewing the systems. Once you know the main reason why the patient wants medical attention, it is sensible to ask about the system to determine the patient's general state of health and to check for any additional problems. The patient should be encouraged to describe symptoms,
Symptoms.
symptoms, right? Spontaneously, initial question if it's needed, but avoid putting words in patient's mouth. Open-ended questions. What's your appetite? Appetite like?
Appetite.
Appetite like? How is your vision? Close question. Have you eaten today? Is your vision ever blurry?
Thank you so much. So here, the patient should be encouraged to describe symptoms spontaneously. Initial questions if needed, but avoid putting words in patient's mouth. Did you have any experience with this part? Maybe in your experience, if you ask something, you should make it in some way that the patient tells you the truth, maybe. Because sometimes patients get a little confused. For example, in my case, older people just follow the instructions I give, and sometimes it's a little bit difficult to find out what is happening to him. So I have to ask to her siblings in this case to help me out, and they will talk with his uh, father, and then we find out what is going on. I don't know if it happens to you too. Maybe with children.
I think like in your case, for most elder patients, you have to ask the patient's family to really know what's going on, because they are not paying attention, or they don't remember, or they just don't want to answer the questions, or they
Yes,
can't.
that's true. It is always better if they are with their family. It's the same with children, right? They forgot some of the things that we are making. So it would be a problem in the future for me, especially. Okay, thank you so much. Can we continue then? I think we don't have any questions, right? Okay, Vale Mercado, can you read this part, please?
Yes. Asking about the central nervous system. 1. Do you suffer from headaches? 2. Have you ever had a blackout? 3. What about fits? 4. Have you had any dizziness? It's okay?
Business?
Dizziness, sorry. 5. Do you get ringing in the ears? 6. Have you ever experienced any numbness or tingling in your hands or feet? 7. Do you have any problems sleeping?
Okay. Thank you. Do you have any questions here? Or maybe a question you can add here if it's missing?
What about fits? What does it mean, fits, teacher?
Like attacks. Yes, it's the same.
Like scissors? Like
Attacks with scissors? No,
no.
what?
What kind of attack?
For example, when the patient, when I was talking with Jorge yesterday, I had a patient with what was epilepsy, and he had an attack, a fit, okay, and that kind of attack.
Thank you, teacher.
No problem. Any other question? Do you remember what tingling means? You don't remember?
Hormigueo.
Okay. Yes. Well, there are no questions here. Nothing else to add?
Yeah, regarding fits,
Mhm.
as Claudia was saying, yes, it's the same meaning as seizures. It's another way to say seizures. In this case, in an epilepsy illness. I don't know.
Okay, thank you. Thank you, Jorge. Any other thing you want to add here? Well, let's continue then. Rina, can you read this part, please?
Yes, teacher. Patient ideas, concerns, and expectation. It is important during the consultation to give patients the chance to express their own ideas and concerns about their problem and to determine what their expectations are. The letters ICE, ideas, concerns, and expectations, are a way
Yes.
of remembering these ideas What do you know about this problem, condition, illness? Do you have any ideas about this? How do you think you got this problem? What do you mean by concerns? What are you worries about this? Do you have any concerns? How might this affect the rest of your family? Expectations. What do you think will happen? What do you expect from me? What were you hoping we could do for you?
Thank you. Okay, do you have this space or give your patients the chance to explain their ideas? Do you think this part is important?
Yes. I think that it's very important that the patient or where we, like a physician or the consultant, it's very important for us, let the patient express the ideas or the concerns, about the illness or the problem they told us. Because the patient, in fact, is have a scare for the situation, because a person, usually that person who goes a hospital or a clinic, is not normal and provokes anxious or nervous for the person. So in the first moment, it's very difficult. The person have the ability to express us the mainly condition or the problem. And I think that for that it's very important. Let the patient tell us, or give them a little space for express ideas or consult us about any question the patient has.
Okay. Okay, thank you, Rina. Yes, it can get nervous or anxious. Okay. Perfect. No questions here? Nothing? Okay. We have some phrasal verbs in history taking. Are often used in informal spoken English. Both patients and doctors may use them in consultations. A phrasal verb may have several meanings according to context. For example, have this bring on. An example, is there anything special that brings on the pain? And the meaning, cause or induce. Bring up. When you cough, do you bring up any phlegm? And the meaning, expectorate or vomit. We have another word, carry on. Carry on taking the painkillers for another week. It means continue. Come on. When does the pain come on? It's an example, and the meaning, commence or start. Okay? Phrasal verb, give up. Example, my advice is to give up smoking. In this case, the meaning is stop. Put on. I've put on a lot of weight in the last month or so. And it means gain weight. Turn out. She had all the tests and it turned out to be cancer. It means happen in the end. Turn up. The rash just turned up out of nowhere. And it means appear unexpectedly. Okay. Do you have any questions here? Can we continue?
Yes, teacher.
Okay, thank you. Well, I have another. We don't have so much time, but I think we can advance. Okay, the physical examination. Examining a patient. When examining a patient, you should, one, introduce yourself if necessary, like, for example, good morning, I'm Dr. Mason. Two, brief the patient on what she should expect in a clear and simple way, or using late.
Excuse me.
Yes.
I can see the presentation.
Oh no.
Yes, we can
Nobody
see.
can see. Oh my gosh. Okay, thank you. I will. Okay, I will share it again. I'm so sorry. Now you can see it?
Yes.
Yes.
Perfect. Well, number two, brief the patient on what she should expect in a clear and simple way. I was telling you that we have to use, or we must use, lay terms, okay, as the most, in a simple way. Do you know what we're going to do this morning? For example, or what we are going to do today is, I'm going to examine your, so I can, those are just examples, okay? Find out what's causing this. What we do is, what happens is that I'll ask you to, are you ready? Okay. Do you think it's important that you can describe every single step that you're making to your patient? Yes, no?
Yes, because the patient can be more calm about the procedure we're going to do, or what are we going to do to the patient.
Okay, it can be confident. And he can help us to go further, right? Three, instruct the patient in a clear but polite manner, as we were saying. Four, show sensitivity to the patient's needs and respond to discomfort, reassuring if appropriate. This might feel a little bit of discomfort, or this might a little, but I'll be quick. Tell me if it hurts. Let me know if it's sore. It will be over very quickly. It won't take long. You're doing well. You're encouraged your patient. Number five, talk the patient through the procedure. I'm just going to, and you explain the procedure. First, I'll, or then I'll, now I'm going to, you'll feel, when it's over, I'll, that's it, or all over. Number six, share your findings with the patient well. I'm fairly certain you've got an app. One possibility is it could be what we call, and you explain what is the patient, what has the patient. I haven't found anything to suggest any problems. Okay, maybe you want to add something else here? Nothing? Okay. Okay, now we're gonna give some instructions. When examining a patient, polite forms are often used for the initial instructions. Could you bend forward as far as you can? If you could cross your arms in front of your chest. What I'd like to do is examine your standing up. After that, direct instructions may be used. Stand with your feet together, lie perfectly still. To soften an instruction. And you just turn this side again. Could you just lay on the couch? Okay. There are some ways to give instructions. And we have here a list of verbs. We have bend down. That means put your, I'm sorry. We have here bend down. As you can see, we can see the image here, the first one. We have breathe in and breathe out. Okay, inhale, exhale, for example. Close your eyes, curl up, and you can see. Do this. Okay, he's guiding the patient. Move. Follow my fingertip with your eyes. Keep your knee straight. Okay, we're giving instructions. Put your head down and put out your tongue. Raise your leg. Roll onto your back front. Roll over, like here, and roll up your sleeve. Okay. Do you understand what is roll up your sleeve with this image? Do you understand that instruction?
Como rotar la articulación del codo, teacher.
It's more like remangar la manga.
To pull up your shirt.
Okay, okay. Yeah, thank you so much. Okay, we can continue. Sit up. Okay, slide your hand down your side. Slip off your coat. Stand straight or stand up. Okay, is it clear here? No questions? Can we continue?
Yes.
Perfect. Let your wrist go floppy. Okay, and he's moving his wrist in a floppy way. Lie on your side or lie on your back. Lie on the bed or on the couch. Lie down. Look straight ahead. Look at something. We are still giving instructions. Open your mouth. Oh, sorry. Open your mouth. Point to the finger that moves. Pull as hard as you can. Here, push as hard as you can. Take off your top things. Tilt your head back. Do you understand what tilt means? No?
No, teacher.
Okay. Inclinar. Tilt your head back. We have the other one. Touch your shoulder with your chin. Turn your head to the left, turn on your side. Other instructions. Relax. Show me what movements you can manage. Tell me if it hurts. Okay. Any questions here? Can we continue then?
Yes, teacher.
Thank you. Well, can we describe the movements in the pictures? For example, number 1, what is he doing? Nobody. Nobody. Claudia, what is he doing on number 1? Can you see it?
Yes. Maybe he's moving his arms up and down.
Okay. Okay, yeah. How can you tell your patient? How can you give the instruction?
Open your arms to up and down.
Okay, another way to say it. Anyone else?
Specifically that movement, I would say, show your palms in the front and raise your arms laterally. Maybe that would be more specific. I don't know.
Yes, okay. It's a good way to say it too. Maybe flex your arms. Be another one. Not as specific as you said, but it can work. Number 2. What would be the instruction for the patient?
Probably teacher, the indication is put your hands back on your head.
Okay. Yes, it can be. Number 3.
We could say, put both hands over your lower back.
Okay, perfect. Thank you, Jorge. Any other way to say it? I don't know, maybe cross your hands behind you. Number 4. What would be the instruction? Carla Calle.
Yes, teacher.
What would be the instruction for number 4?
Put your hands up, maybe.
Okay. Yes. Thank you. Number 5.
Maybe move your head backward and forward.
Yes, it could be one way. We already learned a word that can help us here.
Tilt your hand back.
Yes. Tilt your head back and forward. Good.
Forward.
Number 6.
Tilt your hand to the right and left.
Yes, it's another way. Good. Number 7. Melanie, are you here?
Yes, I'm here, but I'm not sure.
Say it. I know you know. Number 7.
Touch your shoulder with your chin.
In this case, it's turn your head to the
Turn
right or the
over
left.
and left.
Yes. Number 8. Nobody.
It's correct. Lean backwards.
Yes, it can be a way. Another way to say it. Maybe using the new word, tilt your body backwards. Okay, number 9. Well, I think we are gonna
Bend yourself.
thank you, Mateo. Yes, it's okay. It's so good. It's just that we don't have enough time. I think we're continue the next class, okay? But before you go, I will send to you 2 questionnaires. Please fill it both and don't go, please. Tell me if you can see both questionnaires and well, okay. I need, well, I think just one. Please don't go. I need to send to you one more. Okay, one more. Who cannot see the questionnaire?
I already
Someone,
submit the first one.
I don't.
sorry?
I cannot see the second questionnaire.
Me neither.
Okay, I don't send it yet.
Okay.
But the first one, please. Someone is missing. Who's missing? Okay. Okay, I will send the second one. Oh, I don't know. Okay, I hope everybody can see it. Can you see it?
Yes, teacher.
Okay, perfect. I'm going to. Okay, 11. 3 more. 2 more. 1 more. Who cannot see the questionnaire? Okay. In just a second, please. Okay, thank you so much. It will be like that. Thank you so much, guys, and see you tomorrow, please. I will send to you, sorry, I will send to you before you go some practices. I think 2 maybe, because remember that we have 1 week left. And on Monday, I don't know what date is it, maybe 14th or 5th. we have the test, the final test, okay? I will send it to you with the instructions. Thank you so much and see you tomorrow.
See you,
Hey,
teacher.
teacher, see ya.
Thank you.
Bye-bye.
Goodbye.
Thank you. Take care.
Thank
Thank
you.
you,
Bye.
teacher. Bye.
Bye.
Thank you.